Good.
Yeah.
All right, so we are moving into the Alma Regional Health Services and PCG portion. Do your favorites.
Okay, excellent. Well, thank you all so much for having us. We greatly appreciate your partnership. We love our executive board member, Mr. Roundtree. So we appreciate all that you all do to help us partner together for Gates County. We have already sent in, our letters, I believe in February. So you all have all that stuff and that should be in there. We really aren't asking for anything else. Mandy's just here to make sure that, you all don't have any questions for us. You'll see that at Allied, Mr. Shower, it is 15 years, it looks like. So the plan goes through fiscal year 33 as far as the 2.5% index each year. No plans right now to necessarily change that piece, definitely for Gates County. The other piece, the PCG, regional landfill and convenience sites, that's on there as well. And as you know, we do participate in the Albemarle Regional Solid Waste Management Authority, which ARHS also runs. So those budgets go hand in hand. So all of that information was provided for you all, with the indexing and the cost. You'll recall with the PCG landfill, the 3 counties did join together to do a lot of work at the sites this year. I think the only other thing, Scott, that you all may hear in the board meeting, we may start looking at replacements of vehicles. We've gone the same route that, you all have gone with Enterprise, that we took your advice, and that is working out really well. So that will be a much more cost-efficient model even for PCG moving forward. So
That's great.
so all that is worked into the budget, so we can move forward with that.
Things over the other benches.
Yeah, Kim, you want to?
So I put in the packet that you guys have, how we calculate the budgets for PCG and ARSLA. I know when I worked here at Gates County, I never really understood how it was calculated. So in the packet, when you have the colored sheet, this is for solid waste, it's for the authority. And how that budget is determined is I look at 6 months worth of tonnage and project out the remaining 6 months for the year. And then, our admin fee is determined by a percentage based on the tonnage. So for example, Dare County and all those towns will have the higher amount that they would pay in admin fees because they have the highest amount of tonnage. And then the other documents that you have in here is, on the legal sheet, is the PCG budget. So the first part on the legal is the landfill, and on the side, you can see how it's split out. Some expense lines are split out by 1/3, and then there are some expense lines that are specific for just that county. So I've grayed those out, and that's how we come up with that budget. And I've also attached the Gates County convenience site budget. So whatever we have in the budget, other than the health department admin fee and on the solid waste letter, the appropriation, everything else is billed based on what the cost is. So this is just an estimate, so you have a number to put in your budget, but it really depends on how much, honestly, how much trash you throw away.
Now, I will mention that since you have it broken out, you will notice on the PCD overall budget, the only thing that ARHF gets out of running PCG, our total in admin fees that we collect is just shy of 6,000. So, we may begin to look at that in the coming years and begin to try to do a little bit more breakdown. When I did the initial look just at our staff time that actually in admin and, you know, HR, because we've got all those part-time folks and all the convenience sites, we look at finance and everything else like that. The actual cost just in HR is closer to 90,000. I'm not saying we go that high, but that's $6,000. And as Kim said, this is actually split 3 ways between the counties. So you're only paying like $2,000 for us to manage PCG for you. So you.
And we're grateful for that.
Good deal. You got a heck of a deal. But I might have to do something a little bit different in the future.
But I really like the breakdown of which county is paying out for what, like the specificity there is nice. And seeing, like you said, some are the same and some are
Yeah, and the differences are really based on size and that.
Yeah.
And you know, keep in mind too, some of your salary is going to be a little bit higher than some of the other counties because y'all don't close early when time changes.
Okay.
Y'all are the only county that does not close when time changes. Y'all stay open a little longer. You know, so those are some differences that you all have to, that we work with you on.
And that would be a board decision here.
Yes,
And get
if
it
you all,
to-
we would take your recommendations in that.
Is that the only inconsistency in service hours?
Um,
Are we all looking the same number of days? Or-
Yes. Otherwise, you each have a day off in the middle of the week. Sunday is pretty much the same. It's just those, daylight savings hours, that shift.
And I think if they move some of the attendants around, that county will get charged for that time. So if it's normally like a Gates County person and they go to Women's, then that,
And we really don't have that.
not
Yeah.
often, but
We pay for your sites. You get charged for your sites only.
Okay.
And those hours that they operate. Now, what we have done, you know, I will mention this, and we do kind of control this a little bit, just because we have to make the consistent changes if there's weather or ice issues, but we communicate. Now, and what we have done in some of those situations is like, for instance, you know, hurricane season is coming, and knock on wood, we're not gonna have one, but if we were to have to close, like, for instance, on a weekend, and we can get things up and going again, we may open on your day off. Just to make sure we can get it going again. So then, you know, obviously you would see that shift in the billing because we bill by expenses.
And just so that it's not confusing, you did get one letter from the Solid Waste Authority and then one from ARHS. But in this budget on the legal sheet, it includes both PCG and ARSA. So you just kind of basically add those two together, the tipping fees and then, the PCG regional landfill. And that's what comes on that invoice that you get each month. So I hope this was helpful. It was helpful for me once I started doing the billing to kind of understand how this works. I didn't really understand it before.
She's really helped us improve some
Yeah.
communication and documentation for the counties. The counties love it.
Yeah.
So. Do either of you have any questions? Anything?
Yeah, lot to absorb.
A lot, but I love the.
Well, and back to the 5 county comparison. If you were to go to a budget ordinance in Jones County or Allegheny County, chances are their health department cost is considerably higher than the contribution that we have in Gates.
Yeah,
And it's not uncommon for those smaller counties to be spending $1 million, $1.5 million, maybe more,
easily.
just for the public health component.
Yeah.
And that's without home health, if anybody's slipping out.
Correct. Correct. Our public health budget overall, and Mr. Ramsey can speak to this, ARHS, we actually manage about $45 million total. And how that is sparsed out is our public health, so the health department and all of those services, that's about a $22 to $25 million budget, you know, given the year.
Yeah.
The total amount that we get from all 8 counties that contributes to that is just over $1 million. So, you know, about, 5% or less, depending on the year. So, and I believe, your health department appropriation is going to $141,000. You do help manage the building, which is a tremendous help. And I know one thing that you all have been looking at, and I heard you came to visit us and looked at some flooring and measurements and everything. And we greatly appreciate that. We want to provide quality services in all of our buildings and, making sure that we are cognizant. We don't have a lot of the extra funds, as you can imagine, with running such a large agency in 8 counties. Actually, some of our services span as many as 20 counties. We don't have a lot of extra. And so the kind of the agreement is essentially the county covers the building and we cover the public health operations. But, with $141,000, you really by statute, to maintain just the base public health by statute, you would probably have to have a building, a health director, a nursing director, some type of admin and environmental health. So you'd have to have probably at least 5 positions or more. The smallest health department that we have in our region is Hyde County. Their smallest operation was about 10 employees. They are now up to 18. So to kind of give you some kind of comparison on what that looks like.
So this is kind of off a little bit. We talked last week, we said we have an NP 2 days a week, is that right?
Yeah, they're about.
And does that mean, is there like a long wait for getting that person? Like,
Right
it
now-
has To be a sufficient amount of hours, I guess.
Right now, it is a good number of hours, I don't think my father would mind me saying this, he actually is one of our patients. And he had a sick visit, and he typically goes to Perquimans, but he got into Gates County within a day.
Quickly, okay.
So, now, with that being said, we do have, a provider out on maternity leave and some other things going on, so we're shifting. But we are starting to plan, and if she can get here, usually she has some openings. We also, with public health and the fact that we are, we take a lot of uninsured. Actually, when we looked most recently at our board meeting at the insurance and patient payer source breakdown, it's really about a third Medicaid, a third uninsured, no payer source, and a third private insurance. Medicaid is, we get probably close to $3 to $4 million in Medicaid reimbursements, less than $1 million in private insurance, and not even $200,000 in those uninsured. What ends up happening in those situations, especially with the uninsured, we do have a lot of no-shows. So we are really trying to figure out how to balance that. How can we schedule more appointments? Do we schedule 50% more appointments with the hope that half of them come in? It's risky, but we've got to do something, but those are the types of things we're working with our medical director, Dr. Sutton, on. He was actually at our office today in a provider meeting. Now that he is halfway retired, he's gonna come in and kind of do some time studies with our providers to see what we can do.
Okay. That's cool. Risky.
So they don't have,
May have some rough days, but I'm trying not to increase your appropriations.
I know Ralph wasn't able to make it, but could you give us the 2-minute elevator speech on the legislative change that was became effective on the wastewater? And if there's interest, we may need to have that at a more formal meeting, but aren't we doing wastewater now on a regional basis where ARHS controls what used to be a state function?
So what I will explain about on-site, you're talking about on-site systems, and so we adopted local rules. So Mr. Roundtree, so essentially, I might have to do a 4-minute elevator speech, but essentially, if you want to develop any property in northeastern North Carolina, there's about 10% of our soils that by true black and white state regulations are suitable soils that we could build on. And I'm here to tell you, they're not really in Gates County. There's about 10%, a little bit in Perquimans County, I think a little bit in Chowan, but that's about it.
That's 10% that can be.
Can be.
So based on septic systems?
Yes.
I'm not talking about building, constructability, but on.
Septic systems.
All right.
But to build, most of our sites are not gonna be on city or county, they're gonna have to have those septic, so you can't develop without those septic systems, you could not do the development. And so, we have worked for 30 years with soil scientists, NC State University, and developed systems and figured out ways to make these soils work. And work with the counties, work with the building inspectors, work with the individuals. If we were to completely move away from that system, go solely on the state system and use some of the engineered systems that they would require, you are talking a home that may not even be worth $20,000. Their septic system could cost $90,000. It's not affordable. And so Brad Hollowell's a soil scientist, Kevin Carter's a soil scientist, they can work with the engineers, the septic companies to do sand line trenches, backfill, all of those different things to make these systems work. What we were starting to find is that the state regulations were really impeding some of ours, and if we were to be inspected by the state, then we would likely have to halt all building operations because they would not allow our septic program. So we worked with the state. I mean, there's no secret that this is how it is. We are not the only region. There's a lot of coastal areas in the region that have this same problem. So we actually worked with the state and they said, you know, essentially you take the liability by doing your own program. And NCACC covers this. The board got the presentation. So you take it, you develop your own local rules. And we're not gonna mess with you. And so that's essentially what we did. So that way we can work smarter in the future because really one of the biggest problems that was happening is we're having trouble training staff. You know, we're training staff on that gray area that we have to operate in. The state is mandating them the black and white. They're scared to death. They don't know which way to go in. And so we've got to think longevity and long-term to make this happen. I want Ralph to stay for a few more years, but he has been there for 35, so I'll be lucky if I get him for 2 more. He's having fun with us right now, so hopefully he'll stay.
He's 35, yeah, he's earned his out.
I think he has. I think he has.
Well, you all are to be commended for that and the board
Yes, we
taking
appreciate
that
it.
on because it was a needed solution. Eliminates some tremendous headaches. And anybody that wants to try to build a home in northeastern North Carolina will.
Yes. Yeah, we literally had, a quote on for some properties and I mean, poor folks, they couldn't afford that, you know, and it's just not accessible, not realistic. And there are other counties who are following suit. I know Hyde County is looking at it. I think MTW, the Martin Terra Washington Health District. I mean, so we are not alone. Some other regions are very interested in what we've done.
So,
Any other questions? Well, I do want to thank you. If there is any way you have some extra in the budget that we could do some upgrades to the health department. I know some of y'all know, Mr. Roundtree, you've looked, we do have some, like water stains on the walls and those types of things. I will mention, if you haven't been there, please notice that the clinical area is largely carpet. We would love, you know, vinyl, linoleum, something along those lines. It will be a much, safer and healthier option, because obviously in the clinical area, the carpet is not the ideal flooring. But we cannot thank you enough for going out and measuring and hearing us. We know this is something you've been working on for a few years for us, and we really do appreciate
And
it.
buildings and grounds is next on the schedule today, so
Awesome.
we can talk about it.
Oh, hopefully it won't cost you a lot there, but we do appreciate anything that you can do. And I will tell you, like for Clemens County had a similar situation, especially with the floors. And what we actually worked out with their budget is we phased it. So that we worked over different fiscal years. So if there's something that we can do along those lines, just ask, you know, if you can work with us on scheduling, we'll do whatever we can there.
definitely appreciate it. We could not do this without the regionalization.
Excellent. All right,
Well, thank you.
anything you would like to add, Mr. Roundtree?
Just on the inside, curb to requirement is essential, and especially like Mr. Steve mentioned, the flooring essential, especially in the healthcare sector. So we can invest in that, you know, for our health department, that'd be fantastic.
I appreciate it.
Much as forbidden mental setting does the.
Counterintuitive.
Yeah.
You said it, I didn't get that. Right?
We can park it on everywhere.
Me too. Me too.
Yeah, no,